Dermamelan, the world's leading professional pigmentation removal method. Trust the leader. Nowadays, hyperpigmentation or dark spots are becoming a global concern and are affecting millions of people all over the world. There are many internal and external factors that trigger a disorder in the normal production of melanin, the pigment responsible for providing color to the skin. Skin pigmentation is a natural defense process against solar radiation. Melanocytes are located between the epidermis and the dermis. They are the cells responsible for producing melanin, the pigment that provides the skin with a dark color. Melanocytes respond to solar stimulation by producing melanin inside them, which gradually migrates through their dendrites toward the epidermal cells known as keratinocytes. The melanin moves towards the superficial layers of the skin, where it accumulates and makes pigmentation visible. Inside the melanocytes, the triggering factors cause hypersensitivity to solar stimulation, resulting in an uncontrolled, localized overproduction of melanin, which accumulates on the skin surface and forms visible dark spots. Depending on their triggering factors, shape, layout, symmetry, and depth, dark spots are divided into the following types. Melasma. Melasma is one of the more frequent hyperpigmentations and also the most resistant and complex to successfully treat. The triggering factors are multiple. These are dark spots that can vary in tone. The dark spots tend to be extensive, with an irregular profile and with edges that are not clearly defined. One of the most relevant characteristics is that they present in a symmetrical pattern, especially when they appear on cheeks. PIH, post-inflammatory hyperpigmentation, is highly resistant and bears a risk of recurrence, triggered by an inflammatory process caused by an eventual lesion or external aggression such as wounds or burns or certain medication or chemical substances. May appear anywhere on the body, but especially on areas that undergo greater sun exposure, such as face, chest, or hands. Liver spots. They are hyperpigmentations with two variants: solar, caused mainly by the sun, and senile, in which skin aging is a key factor, along with sun exposure. These appear as oval-shaped brown spots with perfectly defined edges, the size of which normally ranges between 2 and 20 millimeters. They typically appear in areas that have suffered greater sun exposure, such as shoulders, the face, arms, etc. Ephelides. Ephelides or freckles are hyperpigmentations of a genetic origin, which are intensified through sun exposure. They are small, flat dark spots that can be found on any skin phototype. They have defined edges and are round in shape and are normally symmetrical. Ephelides are typical of light skin phototypes and can appear on any part of the body. It is essential to previously determine the type of dark spot to be treated in order to adapt the treatment to each individual case. Dermamelan is the world's leading professional depigmentation method, which allows for correction and treatment of all hyperpigmentation disorders in a safe and effective manner. More than 1 million patients treated all over the world support the efficacy of the method for all types of skin and all ethnic origins. Strict quality standards and numerous in vivo efficacy studies demonstrate excellent skin safety and tolerance, followed by visible results from the first week of treatment and long-lasting effects. How it works. Its exclusive formula effectively treats the process involving the formation of dark spots by providing a twofold action: regulating the production of melanocyte and eliminating the melanin formed in order to visibly correct pigmentation irregularities. The Dermamelan method comprises of an in-clinic phase and 3 phases at home, all of which are key for fully and effectively eradicating the pigmentation problem. Following personalized diagnosis, phase 1 of the method, the consultation phase, can commence. This is the intensive depigmentation phase. The products needed for the consultation session are contained in the Dermamelan pack. Oil removing solution. It helps to remove excess oil from the surface of the skin to improve absorption and allow homogeneous results. Apply to clean, dry skin with a gauze. Dermamelan facial mask. This face mask contains a high concentration of active ingredients. Its formula accelerates cell renewal on the surface of the skin, effectively eliminating existing melanin deposits and intensively acting on the blemish formation process. Apply a thick layer over the whole face, not just the pigmented areas. Leave it on for the recommended number of hours according to phototype, severity of blemishes, and skin type. It's important to keep the face mask moist throughout the application time. A water spray can be used to stop the product from drying out. During the application time, the patient must avoid direct sunlight and heat. Once the application time determined by the skincare professional has finished, the patient will remove the Dermamelan facial mask at home. To do this, the patient must rinse their face with plenty of water until all traces have been removed. 48 to 72 hours after removing the face mask, the patient should continue with phase 2 of the at-home regimen, with a duration of 1 month. This second phase of treatment is intensive and represents the continuous depigmentation phase. Dermamelan Depigmenting Cream. The main product of the at-home treatment is Dermamelan treatment, a potent depigmenting cream that keeps working to eliminate existing melanin deposits, lightening blemishes day after day and preventing their reappearance. Apply to clean, dry skin, evenly covering the whole face 3 times a day, morning, midday, and evening. Hydra Vital Factor K. After Dermamelan treatment, it is necessary to apply Hydra Vital Factor K in the morning, at midday, and in the evening to restore the skin's hydrolipid film, protect the skin, and relieve tightness. Moisturizing Sun Protection 50+. To complete the treatment, it's essential to protect the skin from direct sunlight and UV radiation. During this treatment phase, new skin is more vulnerable to sunlight. Apply the sun protection every morning and reapply at midday. During this second at-home phase, the patient should visit the skincare professional halfway through the phase, 10 to 15 days after starting treatment. This is important to assess the patient's progress during these initial intensive phases and to modify the intensity of treatment based on the patient's individual response. The Phase 3 at-home application regimen should be repeated, but the application of Dermamelan treatment and Hydra Vital Factor K should be limited to 1 application in the morning and 1 in the evening. The third phase of the method is the melanocyte re-education phase, aimed at regulating melanin production. The fourth phase of the method is necessary to prevent the reappearance of existing blemishes and the appearance of new blemishes. It involves applying Dermamelan treatment and Hydra Vital Factor K only at night, and moisturizing sun protection in the morning and at midday. The effectiveness of Dermamelan has been demonstrated on all kinds of blemishes and in all ethnic groups, with excellent short and long-term results. The results obtained in clinical studies on patients show a visible reduction of up to 67% in the intensity and area of existing blemishes. Dermamelan, the world's leading professional pigmentation removal method. Trust the leader.